with protein, here's an important question we get, the essential amino acids, because if you're getting a good amount of protein, but you're not getting a good balance of those essential amino acids, are you doing something wrong? Do you have to fix something?
No, you're not going to get, if you're eating beans, nuts, and seeds and green vegetables, you're getting all the essential amino acids, plenty of these, everyone. The fact that it's relatively low in methionine is a good one because we want it to be relatively low in methionine because that's the amino acid that promotes cancer cells to replicate the most.
Should a person know eat a few Brazil nuts to get that up, or it's not necessary?
No, they can, yes, I want people to eat a few Brazil nuts a week, but not because of that reason. Just to get a little extra selenium is good.
Okay, okay. So as long as it's low, then it's low. It's not as a concern. They're still getting their essential amino acids as long as they're eating that good variety of what you suggest in a Nutritarian diet.
Absolutely.
Okay. And so you're saying I have a choice, me personally, or people in my situation. It's like, hey, add some cooked beans or do a lot more of the sprouted legumes.
Correct.
Okay. And would I just look at a paper and look at the numbers on the paper and decide how much more I need to do, or do I just add some more?
Yeah, you don't have to measure it. There's a big range of what's normal. You're feeling good, your weight's down, your strength is up. Just try to keep in mind what I'm saying, that it's good variety is better for you. It's better to eat a variety of different foods and not have your diet be so narrow. And watch that you don't eat too much fruit that you keep you because too much fruit can keep as we age, can keep our protein on the low side. So, those people advocating 80-10-10 with fruit-based diets, they can thrive when they're younger, but if they get older, they get in trouble because their diet's low in protein. We want to have more fat and protein, and so it's not 80% carbohydrate. It's more like 20-20-60. You know what I mean?
Now, when
It's
you say that, it makes sense what you're saying, but the advocates of that diet, they seem to have a great amount of strength, and some of them are older, and they seem to be doing okay. So they're not hitting the warning signs that you're talking about. So, what would you say to that? To confirm it with your blood work? What would you say? Because they feel great, their strength might be doing pretty good as they're getting older. So
Yeah.
what would
This,
you?
I'd say that's as you know, I've been taking care of the vegan community for almost 35, 40 years, and it's not my observation. I've seen a lot of these raw foodists get into trouble and even die of pneumonia. So there's some people that can do well, and obviously I'm talking about, we want to give people recommendations that everybody thrives on, not just some people thrive on. And just because some people can do well with it, I still would not recommend it. There's too many people who don't thrive on it. And I'm talking about really careful people who ate that diet really carefully. One guy who was following that type of diet, because he was such a philosophical anti-medicine natural hygienist, he got to me too late. He came to me with pneumonia, and he wasn't taking an antibiotic for pneumonia. He was too bad. I had to send him right to the emergency room, and he died in the emergency room with pneumonia. He died in the emergency room. He was not even an old guy. He was young, relatively. He's like in his 60s, I think. He died of pneumonia. Um,
So what
so
I
I've
what
seen
I
a lot of people. I've seen a lot of people struggle with issues because on that type of diet. So because some people could thrive on it, good for them. But I know what recommended as a general rule for people, the chance of it's too risky.
what I hear you saying is, if I'm correct, is there are different ways to eat a raw food diet or just a vegan diet in general. And when it comes to raw food specifically, there's the 80-10-10, and then there's the Hippocrates kind of philosophies and then that natural hygiene. And these can work, but it's risky. But the way you're suggesting it in your diet is the safest way for people to eat a vegan diet based on all the information you've gathered. Is that what you'll say? That these other diets can work, but they're risky. But the way you're recommending people do it is the safest and most practical way to eat a vegan diet. Is that a good way to sum it up?
The safest and most practical way for most people. I'm not saying the Hippocrates way isn't good either. That's another good way because they're more raw and more sprouts, but I'm saying that way is not as practical and not as many people want to do it that way. But that's also a way that's probably adequate because they're not giving you excess fruit. They're giving you excess sprouts to take over the extra fruit, and they're sprouting a lot of legumes, which they're not, and they're giving you nuts and seeds. They're just reducing the fruit down.
Like
So they're not
tremendously.
like
They don't
fruit.
even recommend fruit for people that have cancer and stuff like that. They don't recommend fruit at all.
Right. So I don't agree with that, but in any case, I'm saying their high intake of sprouts could make that diet acceptable. But most people don't want to be, that strict
On a
unless,
diet like that, where would they get their omega-3s from?
well, this is the thing. Some people have enough of the delta 6 desaturate enzyme to make enough omega-3 fatty acids from the flax seeds and green vegetables, but most people can't make enough. And we're talking about getting a level above 6 or 7 or 8, getting to a high enough level. So unless you know your level, unless you've checked it in your blood, you can't just assume eating that way gives you a good enough level. So the answer is most of the people need to take supplements to get their omega-3 index in the most favored range. To take a vegan-based supplement.
And is there a test or something to see if you have that way where you don't need the supplements, or there?
Yes, the omega-3 index. You see your numbers.
Oh,
That's
I could see the numbers, but you're saying some people
if your number's above 6, you're not supplementing. You're okay. What if your level was 7 or 8 and you weren't taking a supplement? And you don't need a supplement because your level's 7 or 8.
Gotcha. Hey, last question before we sum this all up is your the omega-3 supplement you have. If somebody was taking the ones you said, it shouldn't make a big difference if they were taking the ones that come in the capsules with the side effects from having too many of those capsules. Does that just dissipate in the body? What happens to that? Is that considered a food or a nutrient, or what is that they encapsulize the oil in?
The capsule, I'm not sure. It depends on the capsule. I think it's made of potato starch or some kind of vegetable gum, matter. It's just a small amount of something. It's probably not a significant risk factor for anything. They're just, you don't need it to eat it, but you're just not going to kill them to take the capsule.
Now, when you decided to have yours, you wanted people to smell and taste the oil.
Mhm.
Is that why you decided not to put them in the capsules?
Yes, that's one of the reasons is because you can taste the freshness, and also we wanted to pack it in glass to keep it in dark glass to keep it fresher. So we felt the refrigerating dark glass. Also, we want people to measure the dose, and the dose it's based on their blood test, so they can take the exact dose that's right for them based on their blood test results, so they can measure it out. You know what I mean? Because every person just taking the same amount of capsules. It doesn't make any sense. They got to take the amount of capsules based on their need, based on the blood test.
Sure. And how often do you recommend somebody get that blood test?
Well, let's say you're taking my supplement, you're taking a whole dropper full every day. Well, you got to wait 4 months for the red blood cells to stabilize to see if that level is going to reflect, the blood test is going to reflect what you're taking. You get it in 4 months and you find your level is low. It came back at 4.5. Okay, it's not that terrible, but it should be above 6. So then you up the supplement and you take now 2 droppers instead of 1 dropper, but you got to give it 4 or 5 months and you take it again and your level is 6.8, and that's good. Okay, my level is 6.8. It's not too high, not too low. I can stay with taking the 2 droppers a day for the next 5 years before I take my blood again. So you take your blood to make sure you adjust the dose and then wait 4 months to take the test to make sure the level is right where you want it. Once you get it in the perfect level, then you can take it, then you don't to check it again for 5 years or so, see if you're still in the same range.
Wonderful.